Hello, my name is Claire and welcome to my channel. Today we're going to be talking about mental health in the wake of COVID-19. And I'd like us to start by defining what mental health is. Mental health is a state of emotional, psychological, and social well-being. So it relates to how we feel about ourselves, how we feel about the people around us, how we think, how we behave, and how we cope with the stresses and the demands of life. Mental illness, on the other hand, is characterized by alterations in mood, thought, and behavior. Now, while we seem to have alterations in mood, thought, and behavior all the time, it doesn't necessarily mean that you have mental illness. For something to be termed as mental illness, or for what you feel to be termed as mental illness, it has to significantly impair your functioning in more than 3 areas, and it has to have existed for a particular period of time. And these are just some of the diagnostic criteria for mental illness. In the wake of COVID-19, so many people are likely to develop symptoms of mental illness, and this can be because of factors like reduced social interaction, increased use of social media where we are receiving so much information about the virus that ends up increasing our fears, or uncertainty about what the future holds, or even grief from losing their loved ones to the virus. Now you're probably wondering, what are some of the symptoms that I should look out for, especially during this pandemic? First of all, it's important for us to know that symptoms of mental illness vary according to disorder, which means that different disorders have different symptoms. Nonetheless, during this pandemic, some of the symptoms that you can look out for include extreme sadness or feeling down, mood changes, confused thinking and lack of concentration, low energy, suicidal thoughts, among many other things. Now, I'm going to share with you some of the ways I think you can take care of your mental health, especially during this pandemic. First and foremost, you need to admit that your mental health is important and then commit to taking care of it. 2, reduce the amount of time you spend on social media because that only serves to increase your fears. 3, make time for social interaction. Social support is a very important factor in mitigating mental health problems. 4, choose to focus on what you can control. For example, your daily schedule. This way, you're not anxious and panicking about things that are totally out of your control. 5, set daily and periodic targets that will help you keep productive during this pandemic. Lastly, when you seem to be having symptoms of mental illness, do speak to a mental health practitioner. Do not self-diagnose. When you self-diagnose, you either magnify or minimize the problem, and that doesn't help. But as well, some of the symptoms that you may have during the pandemic may be because of factors that happened prior to the pandemic. So it's important for you to speak to a mental health practitioner who will understand the problem and be able to help you accordingly. If you'd like to speak to a mental health practitioner, send an email to clareamuga@gmail.com and I'll be happy to help you deal with whatever you're struggling with. If you've liked this video, do subscribe to my channel for more videos that will help you live a better life.